one good knuckle crack before we start.
Welcome to another episode of Cutting Edge Health. And today I am really fortunate to be joined by two guests, Matt and Nikki from Stemwave, who are going to talk to us about this revolutionary product and what it can do for patients and how it can be able to improve people's lives. Again, thank you for joining us as always. One of the things that we're going to talk about is this really unique device that has this small footprint that's close to the size of a penny that can really be able to provide a lot of value and really be able to help people. They're going to tout to you a lot of big names that have been treated by it in the past, people like Joe Montana, which is very apropos when we're talking about the Super Bowl that's coming up pretty soon this weekend. And we're really going to get some insight about how we can be able to do something different in terms of being able to get a much better result. And I'd really like to welcome my guest for joining me here with me today. And here is Nikki and Matt.
Hi. Hello.
Thank you guys for being here with us. Really appreciate it. So as I understand it, you guys have this product that is really unique. That's called Stemwave. Is that right?
Correct?
Absolutely, sir.
All right. You guys mind telling us a little bit about what does that product entail? Where did it come from, Matt? Like, how did this come about?
Well, it was we would use a needle, put it to where we wanted the device to be, and the doctor would just inject it into place. The problem with that is the implant was small. We couldn't retrieve it easily, and you couldn't use it in a place like the epidural space because we would be lost at sea there. So it was better honed and built into a traditional lead style format that we typically see neuromodulation in today, with the exception that we don't actually have a physical implanted battery pack that gets implanted in the patient also. The entire device is contained into a single wire that's completely implanted into the patient.
All right, Matt. So I can tell you guys know your products really well. And you're super fancy. He broke out neuromodulation.
Neuromodulation, sorry.
Did you hear that? He broke out neuromodulation, right? So we really got to break this down like we say all the time. All right. So you're going to explain this to me like I'm five. Now, my guests are way more intelligent than, I can be able to kind of encapsulate this. But as I understand it, sometimes, pictures are worth 1,000 words, right? And so we take a look and we can see from your device that you have a couple different things, right? You have the lead at the top of this picture, right? And you have an antenna and you have it kind of placed. And I think you guys are going to talk a little bit about that. But obviously, neuromodulation is kind of that utilization of ways to be able to influence the nerves in different ways that can help for the betterment of the patient, right? And I think, and I don't want to kind of put words in you guys' mouth, you guys can do it from a couple different ways. You can do it from the epidural, as you alluded to, and you also can be able to do it in the periphery, too. So, like, where the nerves are out maybe in space from, possibly the elbow, the shoulder, the knee, and a couple other places. Is that kind of correct?
Yeah, absolutely. So, we were speaking about epidural, but, the device started as a traditional epidural device and has built into something completely different. where we can stimulate nerves throughout the body, anywhere in the body, and achieve pain relief for patients, which is really refreshing, because in the past, a lot of these patients that have these peripheral nerve issues were really left with nothing. They had, medications, constant injections and things like that. And this device actually gives patients access to a longer lasting device that can help relieve their pain.
Okay. So to me, it sounds like, just like you guys got this sign behind you, that's in my office, that's called hope. It sounds like you guys are providing hope for a whole host of different people who previously didn't think that maybe there might have been hope, right? So I know that you're helping for people that have pain kind of natively, but sometimes you're even helping for people that may have like other procedures where there's like a replacement and they thought that might not be able to give them benefit. But before I start going all off on a tangent, we're just kind of just sort of wetting you guys' whistle, so that way you feel like we got a little bit of teaser to talk about later. I think you guys can be able to maybe help us understand. I know that our viewers have heard about traditional spinal cord stimulator, right?
Mm-hmm.
Where you have the lead that's in place that's connected to the battery. I'm hoping maybe Nikki can be able to kind of explain to us, how does the antenna overlay, how does this all kind of work together? Do you mind showing us a little bit of a picture or kind of some models if you have with you to kind of explain to us what exactly does this mean?
Absolutely. So to put this in the
One second.
All right. To put this in the most simple terms, this is the lead. Extremely small. It's going to lay directly on the nerve. And then we have an antenna, just like so, that's going to lay on the outside of the skin. And this antenna is going to give the lead the information that it needs. And that sends a signal to your brain that sort of tricks your brain. So instead of getting the pain signal that you normally would from that nerve, you do not. It disrupts the signal and gives you some relief from your pain.
Okay, I like it. So it's one of the ways that you can be able to get pain relief by having this not traditional battery, big bulky battery system, right?
Right.
Does that sound pretty accurate?
Yes, correct.
Okay, but as I understand, you guys are just getting started, right?
Yeah.
So there's a lot of other things that you kind of got going on that really is pretty interesting, and you have literature behind this. It's not like we're just saying, oh, we're going to kind of do something that we found in the back of Tony Stark's garbage or something like that, right? You have papers. You have things that really kind of substantiate this, right? And papers that show it's been done in the ankle. It's been done in the cluneal regions, which I think Matt can tell us a little bit about. It's been done at the knee. It's been done in the shoulder. It's been done in and around the hip. That's pretty unique, isn't it?
Yeah, absolutely. And, so we were stuck with spinal cord stimulation in the past where we stimulate in the epidural space, and basically that stimulates everything from that point down. And one of the problems with spinal cord stimulation is if you had pain just in your knee or just in your hip or just in your shoulder, for instance, with spinal cord stimulation, it's very hard for us to hone that in just to that one area. We get what we call unwanted stimulation, where you feel these stimulation waves or pulses throughout other parts of your body that we just didn't want with patients didn't like it and didn't like how it felt. So by us taking it and implanting the implant right at the source of the nerve that's damaged or injured, we're really just focusing just in that area to provide pain relief to that area. The system can be used traditionally, where they would put it in the epidural space and we could stimulate a whole half of the body, either the upper half or the lower half. But we find that there are patients that they don't have back pain, but they have that residual knee pain. Like Dr. Lander mentioned, patients who have knee replacements. We have patients who have knee replacements. The function is replaced with that knee replacement, but the patient will have residual pain afterwards. And it's no fault of the surgeon that did the surgery, but we're cutting into the tissue and those nerves can become damaged, and they could have been damaged well before the surgeon even got in there from the instability of the knee. So by us taking this lead and place it into place, we're able to target that nerve directly at the source and block that pain signal.
Okay. Well, I would imagine for you to be able to do all the fancy stuff that you guys can do, right? I would think there's got to be something special about this lead. So I think you might have a picture to kind of talk a little bit about this. So Matt, what I'm going to do is pop that picture up, and I'm going to have you kind of maybe walk us through and explain this to us. Now, try to do what Nikki did. All right,
I will, sir. I will.
Explain
We're gonna bring it down a level.
Don't get super fancy here. Right? I know I got a whiteboard over there. Stay away from the markers and the chalk.
We won't.
All right?
We won't.
Okay.
Stick with, just with our props we have online here, sir.
All right. Let's have you explain this a little bit to us. Can you give us an understanding about what's going on?
Absolutely. So what we're looking at is other technology on the market. We look at total volume implanted into a patient. So this is a system where you get a trial and then you end up with a permanent implant. When you end up with this permanent implant, we actually implant less than a cc of volume into the patient themselves. Where you look at some of our competitors, those are volume amounts on other devices on the market on how much volume is actually implanted into the patient. The reason we don't have to have that large volume is because of the microchip that's inside of our lead. So we have a miniaturized IPG or implantable generator that creates that signal to the brain. And that little microchip is actually embedded inside the lumen of our lead. So we only have to put the lead inside the patient. And it's powered externally through our antenna that uses our HF frequency to power the antenna and give the lead instructions. I just want everybody to know Dr. Lehner's laughing at me right now. I'm getting too technical. But it's the bottom line is what we're trying to say is we're able to provide stimulation throughout the body with the smallest impact on your body. There's been studies that the FDA has done. They've gone back and looked at the issues with neuromodulation, that treatment of pain with frequency, and a lot of issues come into battery site issues or implant site issues, where the volume is too big for the patient habitus or their size or their makeup, where that implant will start to work out of the body, or they'll have infection or just general discomfort. So by miniaturizing this device and making it as small as possible, it makes it a lot easier for the patient's body to accept it, as well as if you could imagine, it would be really hard for us to put a battery pack in somebody's leg or thigh or something like that. This smaller lead makes it a lot more convenient for them.
All right. So one of the questions I know that sometimes pops up for patients is this MRI compatible? And I think Nikki can probably be able to field this question. From what I understand, it might be. You mind telling us a little bit about it?
The answer is yes. Anything below the neck is MRI compatible, but anything above is not.
Okay. So like we have patients that normally would want to have that different parts to be assessed, right, afterwards, and really kind of be able to figure out, do they have another problem that maybe needs to be seen by an MRI, and this doesn't prevent them. I would use a Matt word like preclude.
Correct.
And so that way they can be able to get a test done if they needed to.
Correct.
Is that right?
Yes.
Okay, fair enough. I think we might have a question that's coming in, probably from Elaine. Phenomenal. Always thank you for joining us. Appreciate you. And her question is the following: can you use it for phantom limb pain? Any idea about that, Matt?
Absolutely. So with phantom limb pain, and we'd always defer back to the physician to make that decision to look at your pain and how it would work. We would typically use it in a spinal cord stimulation fashion in the epidural space, typically to start. But if a physician decided that wasn't really the best approach, we could attack a couple of the other nerves that are coming down the leg to go ahead and block that, or leg or arm, if you had phantom arm pain, to block that limb pain. So absolutely, it's something that we could use in that fashion.
Okay. Now I know some devices they can do different types of waveforms or energy, or the way you guys would probably use it in your fancy language is frequencies. Are you guys able to do things differently with the frequency? And I guess probably more important to our viewers is, so what does the different frequencies really do? Can you tell us a little bit about that?
Yeah, so the different frequencies basically affect your cells in a different fashion and make them do different things. So we use a lot of burst therapy and high frequency to go ahead and block these pain signals. Typically, when we see using high frequency, we get a little bit better response from that because we get we'll see longer lasting relief, doctor, where a patient won't have to wear their external device as much. They may wear it 2-3 hours a day, be able to remove it, and they'll have residual pain because that frequency not only blocks that pain signal, but gives us some anesthetist. Yes, sir.
So let me ask you a question. No. You're great. I'm not. You're perfect. You're perfect. It's perfect. But I thought I heard you say that you could remove the antenna and you still get some degree of pain relief. Is that right? For a little bit.
Correct. So the device wouldn't be running.
Right.
But we would have some residual pain relief just because of the method of action of that signal coming to the nerve, that long-lasting effect. And when we use high frequency, we're going after a different mechanism of action, which is takes longer for your brain to relax from it. Sometimes it's not good to wear the device for too long and have it running for too long because you'll actually have, I like to call bleed over pain, that the device will just stop working. It's more of a therapy that we want you to wear it for a couple hours, pull it back off so that you can go ahead and it'll start to wear off a little bit. You'll start to have pain again and put it back on. It's really not meant to be a crutch or something you have to be tied to all the time.
Okay. So Nikki, can you tell us what are the different parts of the body that this might be able to be used in?
Oh, so this can help shoulder pain, lower back pain, knee pain, foot pain. I mean, honestly, anywhere that you can have a successful diagnostic block, you can put a lead in for pain relief.
So this picture that shows it like shoulder, knee, hip, maybe foot, maybe back, possibly wrist, all those different areas. It looks like you guys have potentially been able to treat. Is that right?
Correct.
Okay. And I think you guys have different pictures from that paper that shows, hey, this is the area in around the tibial nerve at the ankle. And then you have a treatment that's near the hip, right? And then you have a treatment for a knee that obviously has had a knee replacement. You have treatment at a shoulder. And so, I mean, that's pretty important because I think a lot of people make the assumption, whether they've had surgery or not, that they just don't have to deal with it and maybe take some medications and that's the best they got, or have to have a needle utilized probably maybe 3-4 times a year. And this can provide a bit of a sustainable option from what I understand. Is that right, Matt?
Yeah, it absolutely can. I mean, you may still need an injection here or there or other types of therapies or medications. But what we're really looking to do is to knock that pain down by at least 50%. That reduction in pain we look at as a win in our book, that it's going to increase function. It's going to increase your hopefully your enjoyment of life and activity. The biggest reward we get working with patients is the fact that we can give them some type of relief, some type of long lasting effect. We start to look at, their family and who they interact with and everything else when we're helping them decide if this device is even right for them. It's what will they be able to do? What are the possibilities moving forward for this patient when we're able to do this? So it's kind of a neat thing for us, isn't it, Nikki?
And the pain relief is different for each patient. I mean, a lot of things that we say when we're speaking with patients is if you have a hard time standing up and washing all your dishes and you can do that after you have Stemwave placed, or going grocery shopping. I mean, patients can't even walk through an entire grocery store. So even the daily things that this device can help patients with is phenomenal.
Okay, so I know you guys are killing it over here. I think you might have paid the audience though, because I saw there's a question that's coming in that I'm like, oh, good grief. They're really going to nail this one. It's going to be like a dunk from back in the day when the guys used to not shoot 3-pointers, but break the glass. And so this question that's coming in, I'll let either one of you or both of you answer it. It's a question that says, how long does the battery last? Which I think you guys can be, hold your horses, just wait a second. Which I think you guys are ready to jump on real quick to be able to answer exactly what that means and how really it differentiates the product from traditional stem. All right, I'm gonna step out the way because I can see there's gonna be some glass breaking going on there.
We're gonna let Nikki go. Go ahead, Nikki.
So there is actually no battery implanted in the body. It is.
I'm sorry, wait. There's no battery?
There's no battery.
There's no battery.
No. The battery is actually inside the lead. So I know it's very difficult to see from this far away. However, the battery is in the lead. So a lot of patients that have issues with the battery site, that's not a problem with Stemwave.
So
And
wait a minute. So if there's no battery, then do they have to go for surgery to like get stuff removed? I mean, if you're able to give that energy across to that pad and there's no battery, do you have to have a battery change like a traditional stimulator?
well, they do need to charge the antenna.
So I think what our patient online is asking us is they're used to traditional stimulation, and they're used to the fact that every couple of years they have to come back to the office to get a new battery put in. Because their battery, they have a primary cell battery is what we call it, where it's not rechargeable, or rechargeable ones only last for so long. So what's different about Stemwave is you actually, so we have that lead or implant that Nikki was talking about. And when she's referring to battery, she's actually referring to the IPG or the chip that's inside of the lead. Okay. And that's the microchip that says, lead, this is the frequency I need to send to the brain to block the signal. And they got little metal contacts on here that are made out of platinum also. And so these little contacts are the points at which we activate to send that signal to the brain. The key is the battery is sitting right here, and it's always external of the patient. Okay. And we transfer that power through your skin to the lead. It sends a frequency to the lead to say, okay, this is what we're going to do. And here's the power to do it with. So when you need a new battery, all you're doing is unscrewing your wireless antenna from the battery. It's got a USB charger on the end of it. You go to the charger that you have another one sitting there, you unplug it, you plug this one in, you screw the new one into your antenna, and you're back off to go. So there is no battery internally that would have to get replaced. The only time we'd ever have to go back to re-enter a patient to adjust this is if something happened to the lead and it went bad. You know, we have to remember that these are living implants. So anytime you have a living implant inside of a patient, they, things can go wrong. Microchips can burn out. Contacts, wires inside the lead could break apart. They're still always contained inside of the lead itself, though, so there's no danger there. But the only time we'd have to do that is if the lead moved or if something happened to the physical lead internally. From a battery standpoint, we get you a new one. And it's funny, recently we just actually upgraded our batteries. We looked at patient results, patient data, and we found out that batteries were dying faster than they should, and they were overheating externally. And so we actually redesigned our battery, and every patient who had an existing Stemwave, we can just hand them that new battery right now, and they can use it on their existing system. So the system's upgradable from that standpoint, that as we have new frequency, new technology externally, we can just hand that new battery and implant it into that new device. And they just screw it onto their antenna, put the antenna close to where their lead is, and they're back off to the races.
So here at Cutting Edge, we really like being able to bring cutting edge technology. And basically you guys are bringing cutting edge technology where you're able to have a system that doesn't have to have an implantable battery, which isn't just great for comfort, but it's great for the patient in terms of not having to have that consistent battery change, from what I understand. Now, there's one thing that you mentioned, and now we're getting the questions kind of pouring in, but there's one thing that I think you mentioned was so in case the lead moves, but I think moves, right? But I think that you have specific types of leads that try to prevent movement from occurring. And if I recall, before I let you guys get out the gate and really kind of like start getting after it, I think you might have a couple pictures that show the way those leads look. I'm not sure if I have it here, but I'm looking for it. And I'm not sure if you guys happen to have maybe one of those peripheral leads that shows a different piece that prevents it from moving. Maybe it's something like this.
That'll work, doctor.
Where you have kind of on the one side above it, a traditional, I would assume maybe epidural lead, and the other that has these little kind of these little connections that maybe help tether it in place. All right, I'm gonna step out the way because I know you guys are ready to jump after, so I'm gonna let you guys talk. All right, so tell me, how does that work?
The peripheral nerve leads, they have tines. So once the lead is placed, the tines will sort of pop out, which allows the lead to stay still. There's no movement.
Okay. So, I mean, you guys, seems like you guys have kind of like thought about everything here. So I got a few questions for you that are coming in. And I think you guys maybe would explain this because particularly, I think the thing that is a little confusing is because you have this source of power that's coming from outside. And I know that might not be the exact appropriate nomenclature, but you have this kind of divide from a traditional stem. One of the questions that was asked is, so how is this different from a TENS unit? You mind explaining how that's different and what your target is and how things are kind of working a little bit differently?
Yeah, so a TENS unit actually uses voltage that gets sent into the muscle and nerves to activate them to move to. I don't know, and we may have to really refer to doctor on that part, but I don't think a TENS unit is really meant for pain relief. It's meant more for therapy to help those muscles and nerves move while you can't. Spinal cord stimulation or peripheral nerve stimulation, we actually use a frequency. We're not using voltage, we're using a frequency. We're basically creating a little radio station that's saying, hey, nerve, brain, there's no pain here. Don't listen to me anymore. This is the signal. It's beautiful and there's no pain. So I think that's really where I think the difference is between maybe you could confirm, doctor, that I'm on right with our TENS units.
Yeah, I think spot on. I mean, for us looking at TENS unit, I think you hit it right on the nail on the head, right? Where we're talking about trying to be able to target more of that muscle than anything else. And when you're dealing with periphery, we're talking about trying to target that nerve. So like if you had a nerve issue that has kind of that burning, that tingling, that shooting sensation, or it's maybe involved with you having a joint problem, that pain is mediated by the nerve, we're going to say, hey, calm down there, calm down. Come down. That's what we're doing to try to be able to make it not be as problematic, right? Okay, so I think we have another question coming in that is, can a patient control the frequency? Yeah, here we go. So I think you guys may mention there might be high frequency and maybe there might be a frequency called burst or something like that.
Correct.
So are there different programs or things that they are able to switch back and forth?
Yeah, so we can actually program the battery device with multiple programs, and through the center button, you can hold it to change the actual program. So we can set up multiple programs. You can't actually individually change a frequency on your own. There used to be some devices out there I know that let patients into advanced functions, but we really worked to make this as simple as possible for patients. It's on and off. And then you have a power index that we have we'll give you a power index of 10. You'll hit 10 times the positive button and the system's ready to go. But we can set you with multiple programs that would have a high frequency versus a burst versus more of a low traditional frequency. And there's one more thing I think I wanted to mention too, back on our last question with TENS units. I think a lot of patients worry about when they apply a TENS unit and those patches that we constantly reuse with a TENS unit, they'll start to get loose. And all of us have reused them before that have used a TENS unit. And I know there's some burning feeling and some discomfort on the skin with that. I just want to assure everybody, this does not work the same way. It's because we're not sending that actual voltage through the skin. You won't have that discomfort that you would have with a TENS unit with this external device. So I just wanted to mention that and clarify that for us.
Okay, thank you, Matt. I really appreciate it. As usual, you're right, spot on target. Just nailing it, putting it down, making it hit every spot that it's supposed to be. I know that you're getting it. I'm just trying to keep up and making sure that my brain is understanding it in full. And I know that, this Stemwave product is really something that's pretty darn unique. It's out there, but at the end of the day, I think what most people will want to say is it safe and does it work? And I think you guys got some information about its safety profile too from that whole paper, where it looked at kind of baseline scores of maybe a pain score somewhere around 8.5 for the way most of our patients would kind of understand it. And after 1, 3, and 6 months, you saw that the pain relief was probably less than 2 on a scale of 10, right? And that was a really interesting study. I think you guys have other literature that has been supportive of that. Can you guys talk a little bit about the efficacy? Because I know sometimes I think patients will hear, oh, we're not sure if PNS can be able to do the job. And I think that you guys are able to really be able to counter that.
Yeah, absolutely. And I think I mentioned earlier that this is one of those things where you don't want to overuse it. Okay, so we want to use it in moderation. We want to have you use it for a couple hours a day. We don't want to it's oversaturation of the nerves is where we get to the point where we have to use higher and higher voltages of frequency or power sent to those nerves and those receptors. And so, you know, everybody who has one of these implants has a rep like Nikki or myself that is one of your partner in the game. So we work between you and the physician to make sure we can reprogram. How do you use the device? How do you wear the device? And we'll have those conversations. The biggest part, though, of that whole situation is efficacy-wise. We have not seen a decrease in efficacy over time. The device itself, we've been out market, I think 6-7 years now. But adoption has been hard, of course, because it's a new technology, it's disruptive, and doctors sometimes don't know what to think about it. It takes the right doctor to understand that, you know, this is something new, it's something small. You know, some of them just want to put a battery in it. It's easy for them. They do it every 2 years. So I think efficacy-wise, I think we've seen a great, our patients do well. And the other part of this too is, just because it's in there doesn't mean we can't reprogram it. We can constantly reprogram this device to change frequencies, to change the power that we deliver to try and achieve, pain relief. Now, I'll remind everybody, those pain scores that doctor put up, those are great. We can't guarantee that everybody's going to be completely pain-free. What we can guarantee is you're going to have a team that's going to help you, and we're going to try and walk this walk with you. So I think that's important.
Okay, I think that you guys have done a phenomenal job being able to explain exactly what Stemwave is and how it can be able to help patients. So I'm going to kind of give you guys a final question, and hopefully you can give us an answer on what you think. To me, I guess if I was a patient, right, and I'm not getting this in full, what would be your take-home message for me to understand what are really the benefits that Stemwave provides compared to maybe some other treatments that are out there on the market? Can you give that as sort of a summary of how does this seem, or how does it more accurately provide relief that's different from some other therapies that are out there on the market, guys?
I would say one of the biggest things that sets us apart with our device is it's a permanent device with no battery. So there are other devices, peripheral nerve devices and spinal cord stimulators, but they're either temporary or you have to implant a battery. And anyone that's getting to the point where they're thinking about peripheral nerve stimulation or spinal cord stimulator, they've tried everything else. They've tried opioids, they've tried the diagnostic blocks. Like, this is a device that's sort of towards the end of your journey when you're looking to get some relief from pain. And it really does improve the quality of life for patients.
Yeah, I think the opiate portion is huge. We meet patients every single day that they're on medicine. And it might not just be an opiate or a controlled substance. It might just be any medicine. They don't want to be on medicine. So this does give us an option to try. And, the other thing I don't think any of us mentioned is there is a trial that you go through before you have this implanted permanently, where we put the lead in and you get to test drive it for a week, just like you would test drive a car, where you get to try it out, see if it's going to work before we permanently implant it. You also are going to get the chance to interact with our team, and you'll see what your support's going to look like moving forward. But I think the biggest thing is it's another option. It's another tool in all of our tool belts. Dr. Landrum and all the rest of the physicians we work with, they have a plethora of things that they can use to help you with your pain.
But they're always the slide, plethora.
Oh, that's a big word. I'm sorry, everybody.
That's all right. That's all right.
I'm a simple guy, all right?
Fancy,
I'm a
fancy.
simple guy. Big
Plethora.
word.
Plethora. All right, go ahead.
We have
Plethora. Plethora.
There's a lot of things that the physicians can do for you. It's really it's another therapy that's available to you to try. And I think that's the key is I won't single us out as the best or the only. I think we have a lot of attributes that are they're there. The battery situation is huge. The implant volume is huge. And it's a non-pharmacogenic option that you can try. So, I'm sorry, another big word. He's laughing at me, guys. I wish you could be in the room right now. We should have a live cam over here so you can see it. He loves doing it. So, but no, I truly, sincerely, I think it's good that patients try what they can, what's available to them. And this is something we'd love to work with anybody who has a pain issue. If we can, if it's on label and it's something that we could work with, we would try.
Guys, thank you so much for being such great guests and being willing to deal with me giving you a little bit of grief here and there. So in summary, let's say that we have patients that are watching this at a later point in time and they want to find out more about Stemwave. How do they find out more about Stemwave? Where do they go?
So if you're not a patient of Dr. Landrum's, of course, you can contact Dr. Landrum's office. Otherwise, we'd ask you to go to Stemwave Freedom, and you can fill out the form there. And there is a physician locator on our website that you can find physicians that have used our device over the years. But I think the biggest thing is really talking to your physicians, let them know you saw this device on this webcast and you'd like to look into it. And your physicians probably have a good key on, who the right person to talk to is from that point. So I think that would be the best way to do it. Either stimwavefreedom.com or speak with your local physician and talk to them and see if they can help you get access.
Okay. Again, guys, I really appreciate you guys joining us. Thank you so much. And hopefully we may be able to have you back some other time in the future if you're interested. All right.
Sounds good. Thank you, doctor.
All right, guys. Have a great day.
Thanks.
Thanks, everybody.